Welcome to the COE Fidelity Guidelines tutorial on initial assessment. In this tutorial, we will be reviewing the fourth section of the COE Fidelity Guidelines, initial assessment. We do want you to be aware that the slides we're using for this tutorial present the Fidelity Guidelines along with additional resources to support guideline implementation. The written items on the slides themselves may be an overview of a guideline in some instances, so you should refer to the full Fidelity Guidelines document as opposed to the slides used in this tutorial if you need a reference of the written guidelines in their entirety. A few important notes about the initial assessment section. COE should document the challenges with completing the outlined paperwork items when they are unable to meet them within the specified timeframes. There is an understanding that sometimes extenuating circumstances mean that some of the items in the initial assessment section may need to be completed within a time frame outside of what is specified. In these circumstances, it is important for the COE to document what these circumstances are and what the plan is to ensure the paperwork item is completed. In a moment, we will go over the guidelines related to timeframes for certain paperwork items. If a COE prefers to complete additional items on day one, they may do so if the intake assessment does not exceed 120 minutes as specified in the enrollment section. It is important that an individualized approach should be reflected in the notes. Finally, any COE staff person involved in client assessment must be trained in the assessment process and in evidence-based client engagement strategies. COE staff have up to 1 year to complete required training. COE should select staff training that is best for their model and staff makeup. They may reference relevant DDAP trainings as necessary. COE should keep documentation of completed trainings in organizational training logs. To begin, the initial assessment section expands on some of the items from the enrollment section within the Rapid Assessment of Needs section. The Rapid Assessment of Needs is to be completed for COE enrollment as specified in the enrollment section of the Fidelity Guidelines. The Rapid Assessment of Needs is on day one or enrollment and is when all COEs will need to provide an HRSN SDOH assessment for immediate health-related social needs, social determinants of health needs, using a validated tool. Immediate needs should be assessed during enrollment with full HRSN SDOH assessment completed within 7 days of COE enrollment. All COEs will need to identify HRSN SDOH needs in the client's chart and in REDCap. In REDCap, this can be indicated in the interactions under Need Identified. It is important to note that PA Navigate will be available in 2024 as a hub that can be utilized by COEs to place referrals and assess closed loops of service. A rapid care management plan is developed on the same calendar day to decrease risk of overdose and substance using behaviors and to address immediate needs that could create barriers to consistent attendance within the first month after COE enrollment. An extended care management plan around HRSN SDOH gaps can be implemented by the second month and updated through monthly monitoring. If substance using behaviors appear to be constant with no reduction, COE should maintain focus on harm reduction. If harm reduction is appropriate to programming with which the client is involved, and reducing substance use with a focus on pressing HRSN SDOH needs until substance using behaviors decrease. Suicide risk screening is applied by a COE staff member using the Columbia Suicide Severity Rating Scale, or CRSS-RS, or other validated screening or assessment tool. A full comprehensive suicide assessment should be completed by licensed clinical staff if indicated in the screening that is needed. Suicide screening should occur annually unless otherwise indicated by institutional protocols. Screening score and follow-up screening timeframe should be documented in the client's electronic record. In addition, the medical team or trained COE staff member should be available on the first day of COE enrollment to provide an overview of MOUD options to clients. The medical team or trained COE staff member does not need to be on campus. However, all clients have access to the medical team or trained COE staff member, for example, telehealth, to review the MOUD options and the client's preference about MOUD on the first day of COE enrollment. This review includes the client's concerns around stigma and MOUD. In addition, all clinical questions regarding medication should be documented and discussed with licensed medical providers during the client's first visit with the medical team. The ASAM is another component of the Fidelity Guidelines that has been a COE requirement in the program's inception. The M8 Bulletin states that COEs are responsible for ensuring that each COE member receives an American Society of Addiction Medicine, or ASAM, level of care assessment, conducted by either an employee of the COE provider or a qualified provider who accepts referrals from the COE provider. Appendix and Exhibit G also reference ASAM completion as a component of care management services provided by COEs and state that these assessments can be completed by the COE or through a referral. The Fidelity Guidelines lay out additional guidance related to ASAM completion, stating that ASAM level of care assessment is applied by a trained person to each client within 72 hours of their enrollment unless an ASAM level of care assessment was completed within 6 months prior. It is recommended that the ASAM level of care assessment is reviewed and updated, if needed, by the COE during enrollment. An ASAM level of care assessment will assist the COE staff in determining the level of care that the client should be referred to for substance use treatment. If the ASAM was completed prior to COE enrollment, the date of completion should be documented in the client's electronic record. If the ASAM was completed at an outside agency, it is recommended that an ROI be signed by the client to obtain a copy of the most recent ASAM level of care assessment. The care coordination pieces of this section of the Fidelity Guidelines are also important, as they align with the MA Bulletin requirement for COEs to refer and connect COE members as clinically appropriate to all ASAM levels of care within the timelines prescribed by the Health Choices Program Services Access Standards for emergency, urgent, and routine situations. For more information about ASAM requirements for COE, refer to Appendix 14, which indicates the training requirements for COE staff to complete ASAMs. Please note that CRSs may not complete ASAMs. An original requirement from the MA Bulletin was utilizing an assessment tool or questionnaire to identify a COE member's treatment and non-treatment needs and to refer COE members to resources for identified non-treatment needs and social determinants of health, such as transportation, housing, nutrition or food, education, employment, training, legal services, and child care. In addition, the current Appendix and Exhibit G state that assessments to identify a member's needs related to social determinants of health, administered in a home and community-based settings whenever practicable, are one component of COE care management. The Fidelity guidelines provide a time frame for the completion of this assessment, stating that all COEs will need to provide an HRSN SDOH assessment for health-related social needs, social determinants of health needs using a validated tool within 7 days of COE enrollment. Further explanation of the PREPARE and the Accountable Health Communities Health-Related Social Needs Screening Tool, that's the CMS HRSN, can be found in the appendix of the Fidelity Guidelines. These resources are recommendations, not requirements. Clients can be assessed using a rapid HRSN SDOH assessment at least monthly for the first 2 months, with the full HRSN SDOH screening repeated every 6 months thereafter while they are enrolled in the program. We will discuss care plans and more in the next section, but care plans should also be updated every 6 months or sooner if there is a new identified need. In addition, all clients should receive the brief assessment of recovery capital, the BARC-10, in the first 30 days following COE enrollment. It is recommended that BARC-10 scores are utilized by COE staff to assist clients in building recovery capital. There are also some optional additional screenings to include within the initial assessment screening process. These are the MOED placement guide, which can be applied by the COE medical team to each client within 48 hours of their enrollment, and a client risk screening process that at a minimum includes placing the client into categories for more intensive to less intensive care management interventions based on their risk for overdose. You can consider using Peru's risk screening instrument. Appendices 10 to 13 and 15 to 16 within the Fidelity Guidelines provide more information about many of the tools mentioned in the initial assessment section. Appendix 10 has the high-risk screening tool developed by Peru, mentioned in the initial assessment section as an optional screening, as well as a tool to rapidly assess needs. Appendix 11 has the social determinants of health assessment, the PREPARE, which is a recommended SDOH assessment. Appendix 12 has another social determinants of health assessment, the Accountable Health Communities Health-Related Social Needs Screening Tool, that's the CMS HRSN, which is another recommended SDOH assessment. Both the PREPARE and the CMS HRSN are recommendations and not requirements. Appendix 13 has the Columbia Suicide Severity Rating Scale, the CSSRS, which is one example of a validated suicide screening tool. Appendix 15 has the Brief Assessment of Recovery Capital, or the BARC-10, which is required to be administered within the first 30 days after enrollment and repeated every 6 months. Appendix 16 has the Medication for Opioid Use Disorder, the MOUD, guide, which is an assessment in the optional assessment section to help clients receive the form of MOUD that is most appropriate for them. MCOs ensure that the assessment process, including timeframes and instruments, as well as the application of evidence-based client engagement processes, are applied as described. Assessment timeframes may be monitored through chart review, while application of evidence-based client engagement processes may be monitored through the submission of training logs. MCOs provide feedback to COEs based on Peru-provided REDCap data reports around engagement and retention within the first 90 days. Identification of factors that appear to be leading to disengagement, including slow uptake of MOUD, slow uptake of care coordination, limited or no monitoring of substance use behaviors, racial disparity, or transportation distance to the COE may be found through client chart reviews. MCOs will receive and review Peru-provided REDCap reports that focus on disparities quarterly. Through chart review and/or review of COE's policies and procedures, MCOs can confirm the documentation of items related to the initial assessment outlined in the Fidelity Guidelines documentation guidance. These are the assessment guidelines specified throughout the enrollment and initial assessment sections. On day 1, the rapid assessment for immediate health-related social needs, social determinants of health needs, and the suicide risk screening within 72 hours, the completion of the ASAM within 7 days, the full screening for SDOH HRSN needs, and within 30 days, the BARC 10, and by month 2, the completion of the extended care management plan. As previously indicated, if a COE prefers to complete additional items at enrollment, they may do so if enrollment does not exceed 120 minutes. The documentation guidelines for the enrollment and initial assessment section are tied to these timeframes. The documentation for the day 1 items was previously discussed in the enrollment section of this training. There are just 2 more day 1 documentation items that are expanded on in the initial assessment section. Documentation that all clinical questions regarding MOUD were discussed with licensed medical providers during client's first visit with the medical team. If the first visit with the medical team occurred on day 1, otherwise document that clinical questions regarding MOUD were addressed on the date of the first visit with the medical team. Also, documentation of the challenges completing the outlined paperwork items when unable to meet them in the specified timeframes. The documentation guidelines for the items that the guidelines suggest should be completed within 72 hours of enrollment include documentation that the ASAM was completed or results were received from organization that completed it within the last 6 months with an appropriate ROI. Documentation of the ASAM level of care recommended based on the assessment. Documentation of who completed the ASAM level of care assessment. Was that an internal, an external, what position it was, the community-based care management team member or other staff from the organization that completed it. Also, documentation of the challenges completing the outlined paperwork in items when unable to meet them in the specified time frame. Within 7 days, the documentation guidelines focus on documenting the items that should be completed within 7 days of enrollment. Documentation that a full HRSN SDOH screening was completed. Documentation of who on the community-based care management team completed the HRSN SDOH screening with the client. HRSN SDOH needs identified in the client's chart and in REDCap by using need indicated. Referrals that were placed based on the HRSN SDOH screening results identified in the client's chart and in REDCap, that would be referral for service. Documentation of the challenges completing the outlined paperwork items when I'm unable to meet them in the specified timeframes. Similarly, the items that should be documented within 30 days align with the BARC 10, as that is required to be completed within the first 30 days of enrollment. Documentation that the BARC 10 was completed with the client and the domain scores. Documentation of who on the community-based care management team completed the BARC 10 with the client. There are also some items that are listed in the documentation guide as items to document in subsequent care management notes. This indicates documentation as some items are repeated or updated in line with the guidelines. This includes documentation of repeated rapid HRSN SDOH assessments during the first 2 months, documentation of repeated full HRSN SDOH assessments every 6 months, documentation of care plan updates every 6 months or sooner if there is a new need identified. There is just one policy procedure item related to the initial assessment, and this is that training plans for all staff involved in client assessments that include engagement best practices like motivational interviewing should be documented in the COE's policies and procedures and be updated regularly to indicate that training was completed. Thank you for joining me for this tutorial about the initial assessment section of the COE Fidelity Guidelines. Please contact your Peru TA provider with additional questions or requests for support.